And good afternoon. Bon après-midi, and welcome to this Munk School of Global Affairs and Public Policy discussion of cities after COVID. My name is Marcia Young. I am a journalist and CBC radio host. I will be your moderator in today's discussion. The new coronavirus has forced us back into the safety of our homes. We are beginning to emerge. Some cities are well into phase 2, while hot zones like Toronto are still at the beginning from the comfort of our homes. We have watched the stories of injustice and racial inequality unfold. Some of us have burst onto the streets in protest, demanding change. Many people say that COVID is giving us an opportunity to remake our cities so that they work for all the people who live in them and around them. So how do we seize the day? Let's talk to some experts. I'm joined by 4 panelists, but before we get to some of them, we are taking questions from the audience through the Zoom platform and through Twitter, and you can email us at events.munk@utoronto.ca. All right, so let us get started with our 4 panelists. First up, Richard Florida, professor at University of Toronto School of Cities and Rotman School of Management, distinguished fellow at NYU and FIU, and co-founder and senior editor, the Atlantic City Lab. Nathalie Des Rosiers, professor of law and principal, Massey College. Anita McGahan, university professor, and George E. Connell Chair in Organizations and Society, Rotman School of Management and Munk School of Global Affairs and Public Policy. Shauna Brail, Director and Associate Professor, Urban Studies Program, Associate Director, Partnerships and Outreach, School of Cities, University of Toronto. Thank you all for joining us today. It's great to have you. Let's start with Anita. Before we get started, this discussion is sponsored by Innovation Policy Lab at the Munk School of Global Affairs and Public Policy, School of Cities at the University of Toronto, and Massey College. Anita, more than 55% of all people worldwide and 80% of Canadians live in urban areas. What role has the city played in accelerating the spread of the COVID-19 pandemic?
Well, there's so many dimensions on which the way we interact in cities has affected the transmission of the disease, the way that we obtain healthcare for it, and has amplified the vulnerabilities of people in our society who have long been at risk of contracting disease because they don't have access to good healthcare or because they're in structurally deficited situations. Let me just point to 5 main things just to kick us off and get our thinking started here. The first is, if we reflect, for example, just on the density of our housing and the way that we have to go up and down elevators and the way that students at the University of Toronto, for example, mix through buildings, skyscrapers, and so on, that density alone is going to expose us to infectious diseases of all types, including especially COVID. The second thing is we have, of course, a great deal of specialization in cities in our jobs and the way that our economy works, and that means that we have to interact a great deal in order to be able to execute economic transactions, and that feature will also lead to the potential for contact and the potential for transmission. A third thing I want to mention, and I alluded to this just briefly, is that cities are places where people who are vulnerable come for opportunity, and where often they don't have access to the opportunities to stay away from frontline positions. For example, in the United States, which is where I am right now, having gotten stuck here, there are many people who are vulnerable to catching COVID, people of color, Black people, elderly, people who are frontline workers, disproportionately frontline workers who are in those roles which are often paid less than professors at the University of Toronto, for example, who are sitting behind glass Zoom screens, who are exposed as a result of their service to society. The fourth thing is there's interaction between cities. Cities are often places we go to get someplace else, and that can play a role in the pandemic. And then the fifth thing I wanted to mention is that cities are often places we come to get healthcare when we're sick. So that also has a role in transmission.
Shauna, the School of Cities is going to soon release a report in conjunction with the Munk School and Schwartz-Reisman Institute on Municipal Governance. Give us a brief look at some of those recommendations and tell us how COVID presents an opportunity for cities.
Sure, thank you, Marcia. So about a year ago, a little less than a year ago, we started to look around mostly at what was happening in Toronto around some really tense conversations being had in the city, some related to, the redevelopment of our waterfront lands, but also conversations about what directions we need our city to go in as a 21st century city with, in many cases, 20th century systems of governing and rules. And we held a series of roundtable workshops throughout the fall with experts from a number of sectors: government, community organizations, nonprofits, research, academics, to talk about changes that we could think of, changes that would make a really sort of significant difference in how we govern by being more innovative. And so we talked about managing land use change, managing transportation change, thinking about data governance, and how we use public realm. What's really amazing is that actually, as a result of, it's not necessarily amazing, but really sort of shines a light on the fact that what coronavirus has done for cities is shine a light on the notion that we've had many of these challenges already. It gives us, in some respects, a chance for a redo, a re-envisioning of what our cities could be and where we want them to go. And so this report takes some of these sort of the key messages that came out of these roundtables, things like the fact that organizations responsible for governing really need to place greater emphasis on a culture of openness, experimentation, risk-taking. These are all things we're saying today too. We need to be able to track and evaluate performance and outcomes much more effectively. And we see this so clearly with tracking data, including race-based data, about the transmission of COVID in our province and in our city. We need to think about prioritizing and privileging considerations of equity through really intentional strategies. And we need to collaborate with a range of partners from all realms. So this report will be released on Thursday. You can find it on the School of Cities website, on the Munk School website, and I think also on the Schwartz-Reisman Institute for Technology and Society site. It was a collaboration, much like this event is a collaboration, or this webinar today, and really highlights, again, just how crucial it is that we're talking to one another, because by bringing to bear all of these perspectives, we can actually lead to greater change and improvement for the future.
But cities have a really complicated space. They occupy a complicated political space, constitutional space. This is where I turn to Nathalie and ask her about how there is an imbalance between the province and cities when it comes to power and control and how they are run. What is it that cities in this country can do to redress that, to better serve the people and maybe make some of these changes that Shauna has been envisioning and thinking about?
Well, in a way, I think what we know that changes will need to occur, but it may not be at the cities themselves. The provinces and even the federal government must start to realize and starting to realize the importance of cities, both for recovery, but also the importance as drivers of innovation, drivers of the economy, but also social hubs, places where ideas, innovation develops. But they need investment, and they cannot be continued to be considered a little bit like sub-governments. And that's part of when Shauna says we have maybe the governance of the 20th century for the cities. Our constitution is a 19th century document, and it sees the cities as being the creators of the province. So really a junior type government. And that has prevented cities Toronto, Montreal, Vancouver, from really having enough leverage and enough power to do long-term planning, to have the good resources that they would need. There's a complicated history, but I think that's my work. That's what I work on, is how do we reimagine space for cities in our Constitution?
You say the word constitution, and I think just coming off the anniversary of Meech Lake, there might be a few people who are reticent,
Yeah.
who are, you know, oh, do we have to go there?
Well, it may
what
not
do you say?
Yeah, it may not mean a constitutional amendment. You know, the Constitution exists and has lots of different avenues that could be used without changing it. So that's the key. Is there's political power that's being existed, but they may be innovative way of reading the Constitution in light of our needs for the 21st century and the great needs that we identify for cities that have to be equitable, where housing has to be there, where cities will be faced with lots of challenges with climate change, because there will be climate change refugees coming to cities. There will be increase in population. So we need to have the tools to make the cities work. Otherwise, Canada will not be in good shape, but in general, the world will not be in good shape.
Well, how quickly do you think that needs to happen?
Well, I think there are some different avenues. There's no silver bullet, as we say. You know, it's a reason to try to experiment. I think the opportunity for the federal government to invest in cities that it has advertised, to invest in a different way, instead of with strings attached, to be a little bit, to give some longer runway for cities to plan, maybe one element. I think we really would want the province to follow suit in terms of respecting a little bit the capacity of cities to plan for a long time. So avoid stepping in and taking over, for example. So those are discussions that we will be having at Massey. We have a long string of dialogues on this very issue of, you know, how do we protect the space of cities' governance.
And Richard, let's get to you. People have been protesting now in cities across the country. And as far as Tokyo, they've had Black Lives Matter protests this past weekend. People are out with their masks, with their placards in this time of COVID. And there is systemic racism that reaches into how our cities have been planned. How can we begin to undo some of this unsustainable planning?
Well, this is something that's very, very personal for me. I was born in Newark, New Jersey. And as a young boy, about 9 years old, it was a July day. My dad was driving me because he wanted me to take musical lessons to my guitar lesson. And we heard gunshots. We saw our city on fire. And we saw not only police, but National Guard and tanks occupying our city. Now, I don't think it dawned on me till much later, but that was the event that made me an urbanist. I think as a young boy, I was trying to figure out where these issues of racism, police brutality, that episode of unrest in the late 60s in the United States, like the current one, was triggered by acts of police brutality. Why was this happening in my society? And now we come to this moment, and many people see this and they immediately get a dystopian take. The combination of the coronavirus, the economic and fiscal fallout, you know, the challenges to city budgets, to workplaces, to offices, transit. And now this is going to lead to this end of cities. People are going to, and you know, they even had the map in the New York Times of where the New Yorkers left to get out of Manhattan. What they didn't tell you is only 1.6% of New Yorkers, and most of them went to nearby places and they're coming back. But I think, you know, we have a possibility of building better cities. And you said this. I think that what the COVID crisis did and the Black Lives Matter protests, they've shined the brightest light I've seen in my life on systemic racism and class injustice. And you look at the statistics, and Anita mentioned some of them. The fact that this disease has so targeted Black and minority communities, that it's a disease associated with poverty, not only old age and pre-existing conditions, but poverty. is a pre-existing health condition. And the fact that it's taken such an enormous toll on racial minorities tells us something and you know, this is different than the 60s in one other respect. In the 1960s, cities were going down. They were on the downswing. Business and industry and people were fleeing the cities and going to the suburbs. Now cities are on the upswing. And what's so interesting, and you've heard many people, Orlando Patterson said this, Ta-Nehisi Coates said this, and you know, as I read them, this is a time to be upbeat and positive. You can see an arrow of positive change pointing, because the protests are so much more multiracial and multi-class than the protests were in the 60s. This is a broad-based group of Canadians, of Americans, of Europeans saying, enough's enough, and we need a better way. So I think for the first time in my life, I'm being honest, as someone who studied cities for 40 years, we have a moment, we have to do better, as you said, plan better, invest better. We are at a moment where it is possible to envision a more inclusive, a more just, a more equitable, a more vibrant, and a more resilient city. And that, to me, is the biggest positive of our time.
Well, we are making some efforts to do that here in Toronto, but let's take a look at one small area, housing. Right now, we're seeing that the Globe and Mail had an article talking about the people most likely to be evicted are Black people and people of color. They've been able to break it down by postal codes. We have a plan in the city to get people into affordable housing, but a lot of that affordable housing seems to be in areas that already have a lot of people of color and Black people, and they're not necessarily along the subway lines, and the ones that are have very limited numbers of housing at affordable prices that are part of that plan for affordable housing. This is a phased thing. Has just begun. But Shauna, how can affordable housing help to right some of this racial inequality?
Well, I want to take a step back from the idea that we now are at this sort of moment of opportunity for cities to reimagine, to really acknowledge the very devastating impacts of the pandemic on lives and livelihoods, but also on people and on communities. And I think that leads into the housing piece, because what we've seen is that, talking about cities and what does COVID mean for cities? What COVID has informed us is that it's not the density in our cities that's a problem that's leading to these massive outbreaks. It's actually the greatest sort of impacts and the greatest kind of outbreak clusters are often in places where there are vulnerable conditions. So whether that's in overcrowded housing where there are multiple unrelated people sharing a bedroom, sharing bathrooms, whether that's in our factories, particularly in food production, whether that's in other sort of frontline workers who have very far distances to travel in order to get to work and who aren't privileged like we are to be able to stay home. And so we also see that cities are taking the lead on thinking through how to expedite and amplify some of the work that was already taking place with respect to housing. So in the city of Toronto, for instance, probably about a year ago, a program was announced to look at how to repurpose city-owned land, so to take out the equation that makes the land so expensive, to have city-owned land, and to redevelop that land with housing on it. So whether there might be parking lots, whether there are other city-owned properties that can be suitable for housing, and then going through the planning process to work with communities and neighborhoods to understand and to go through the sort of development and engagement process that goes along with building new housing, but also going through all of the rest of the planning activities that need to occur. And because the city is leading it, doing it in a way that is intended to be expedited. And I think it was just last week that it was announced that many of these projects have been delayed, in part as a result of coronavirus. However, we know that there are other construction projects taking place that haven't been delayed. In my own neighborhood, I go for a walk, I see there are houses that have gone from nothing to sort of almost fully formed in the last couple of months. So we know, construction in many places has continued. There is a lot of pressure on the city to think through how to address the housing crisis that we find ourselves in, partly for reasons of equity and for all of the reasons we've discussed, but also because if we can't provide housing for the people we need to work in our city, then what we see is this kind of an exodus where we can no longer have a vibrant functioning city. And we know that ideally, a vibrant functioning city actually includes people from a range of income groups and a range of backgrounds. And what we need to do if we want to encourage that is to really think through how to prioritize building affordable housing, supporting that housing. As I said just before we got onto the larger call, part of that has to do with priorities and public investment, right? And the cities that are doing this at a really large scale are places like Copenhagen and Amsterdam, where there are large proportions of housing, which is generally dense, multi-unit, kind of multi-story dwellings that are publicly owned and invested in. In Singapore, almost 90% of all housing is public housing. In Toronto and nationally, there hasn't been a federal program to support really at any scale public housing for several decades now, and our cities and our big cities are really feeling the crisis at the greatest possible extent.
So density in terms of disease has been a bad thing. What should we do going forward? Is density something that we have to move away from? I know, Richard, you've talked a lot about cities like Germany that don't have the same kind of skyscraper culture that we do, and thus their density is different. What is the answer? Maybe I'll throw that out to both Anita and Richard to tackle that one.
Sure, I can start just echoing with what Shauna and Anita have already said. I don't think density has been the core feature of what has propagated the virus. I think it's been both pre-existing conditions at the demographic level and community level, both in terms of old and vulnerable communities and poor and vulnerable communities. And as Shauna rightly said, it's been tremendous overcrowding. Where the disease is really propagated is where, you can have rich people density right in Toronto, where people can live in an apartment or an elevator building and stay inside and have everything delivered to them. It's very different than poor people density, where just to live your daily life, to get to work, to go to your frontline service job, to provide for your family, you have to go out and be amidst people and oftentimes take transit and be in cramped quarters. So, look, there are a variety of, and this is something we have to get at. The community and socio-demographic conditions that spread the virus is something we have to get at. One thing I do want to say, though, is as an American who spent part of this pandemic back in the States, Toronto has handled this pretty well, and not just from a public health point of view. Many of the things that many of us, and particularly me, have taken for granted about Toronto, the fact that we have provincially funded public schools that work, that provide, don't get me wrong, there's all sorts of inequity, but much more equality to a Torontonian than a resident of New York or Los Angeles. The fact that we have universal healthcare, warts and all. The fact that the University of Toronto is home to 95,000 students who often come from working class backgrounds, which would never be the case at most similarly ranked US institutions. We can go on down the list of these things. It means that Toronto has weathered the storm not only of the virus, but of this crisis in a very different way. You can feel it. Coming back from the States, there was, don't get me wrong, there's anxiety here too, but a completely different level of anxiety. And I think there's a lot to be learned from that, from cities down south. And it wasn't surprising to me to see the startling statistic that the fastest growing community in all of North America was not a Sunbelt city like Dallas or Houston or Atlanta, but was Toronto. So I think there's plenty we've done wrong, but before we say we've done everything wrong, there's a lot that other cities can learn from what we've done.
Anita?
Thank you. Just to build on this, I think the role of density in cities has changed through the course of the pandemic. At the beginning of the pandemic, we did not know enough about this disease and how it was transmitted. And there were hotspots of transmission that broke out in cities because on subways, on, in parks and things like that. And we quickly learned that social distancing or physical distancing and everything else that we now have all hopefully made habitual, things like hand washing, hand sanitizer, having good habits with regard to who you spend time with in close proximity and so on. All of those things have evolved over time in cities to keep us safer. And the people in cities who are having difficulty with transmission and who are contracting COVID are people that can't do those things for a whole range of reasons. Can't do enact those habits. Single parents whose kids are home from school, but who can't afford not to work. And you are imposed restrictions on your activity. And now I've got to work to put food on the table, under the table, or I've got to make some arrangement with a neighbor to share childcare, and one of us can go out and work, and illegal construction jobs, or let me call them informal construction jobs, exploding and things like that. So there's a really complicated set of circumstances that conspire to make the density of the population in cities, places where COVID spreads among vulnerable populations that go beyond pre-existing conditions and the overall. We know that poverty is one of the greatest indicators of the potential for ill health, and here we see how the mechanism works in real time. I also just wanted to build on quickly on what Richard and others have said about the United States. The situation in the United States right now is a perfect storm that is welcome to many of us as way overdue. We have a very heavy politicization of COVID in the United States. There's a camp of people that believe that COVID is a hoax and that mask wearing is an unjust restriction on freedom by liberal scientists who are trying to control the right. There's a failure of national leadership in the United States and consistent messaging and national medical protocols and things like that we have not had in Canada at all. This morning I was talking with someone on the radio about how it's been confusing. I can only have 10 people who are social contacts, and now I can only have gatherings. That's confusing, but it's been consistently confusing in Canada in the sense that the messaging has been the same through time, and you have to learn it. But in the United States, that has not been the case. And that, I think, is a failure of national leadership. And then we have a 400+ year history of brutal racism in the United States with an unbelievable imprisonment of Black men. And I think it's 1 in 6 Black men imprisoned in the United States at any point in time. This unbelievable, unconscionable militarization of the police, with the police, providing a kind of framework and a backdrop of legitimized violence against Black people that is simply intolerable to the great majority of Americans. We also know that there's a lot of things that can be done to improve policing. Having police show up at protests not in military gear, more mental health and support and counseling for police. Better protocols for training police in the use of weapons and things like that, greater sensitivity and so on here. I read a statistic that in New York City last month, May, 93% of COVID-related arrests were made of people of color, and so went the statistic, and nearly 20% of the police were out sick or in quarantine with COVID. So this is a public health initiative that's being implemented by the police. The whole thing is completely confounded, and the United States is in a very, very different situation with regard to taking on these challenges than any other country right now.
And you bring up the policing statistics and how they directly affect negatively the lives of Black Americans and Black people in Canada as well. And the conversation started in the US about defunding the police. So taking some of that money away and putting it into other services that would benefit the community more directly, whether that is mental health, childcare, or other avenues. Let's just talk about that for a minute.
Sure.
How are you all, who are watchers of cities and how they grow and how they serve people, thinking about that aspect of defunding police, which is taking some of the pot of money that they have away? I'll let you go, maybe Nathalie.
Well, I think the real issue is where if you defund the police, which a lot of people see this as a way of transforming the police, you have to make sure that it goes at the right place, that it goes into social services that are needed. And I think that's will be the key question is reimagining of stopping to see the police as being the place where everybody goes, and kind of moving away from that model where you have people that attend to needs from the mental health perspective, for example, with sufficient security for sure, but without having the police. I mean, I wanted to comment on the fact that we're 10 years from the G20 in Toronto, so it's not as though we haven't had our own history of police violence and mass arrest. I think policing has changed of protest a little bit in Canada. We're going to have that discussion next week here, but it's important to recognize that there's a real need to reimagine police. I mean, it's a shame what's happening. It's unbelievable. I was reading this last week, and I was the head of this Canadian Civil Liberties Association 10 years ago, and I was reading what I was writing 10 years ago, and we were asking the same thing: stop having racist policing, and here we are, another Indigenous man again being shot last weekend. So there's a real issue in Canada with particularly the RCMP at this point, but all policing, to look at accountability, to look at changing the model of the training.
The one thing I will say is having grown up in the United States and been beaten up by a cop when I was 12. So just think about that. 12-year-old boy being slugged by a cop, basically for playing with his friends. Canada has problems, but the problems in the and I'm not trying to minimize them, the problems in the United States are at another level of magnitude. For example, in day-to-day life in Toronto, I seldom hear a siren. I seldom see it. In any American community, there are sirens everywhere. There's a police presence everywhere. And never mind the way that is amplified in minority communities. Look, the defund the police movement, whether you like those words, whether people like those words or not, is one of the most important movements we have seen in advanced societies in my life. And we know there is a broad body of research that shows that there are ways that in fact, police presence doesn't make communities safer, it just ups anxiety. Now, you do need police to deal with some certain elements of violent crime and other things that go wrong. But in general, and this is the research of brilliant criminologists like Patrick Sharkey, who's also a brilliant urbanist formerly at NYU, now at Princeton, the stronger you can make that community social fabric, the more in which you invest in community organizations and schools, neighborhood-based organizations, as Nathalie said, mental health, the better. And police then become something you need as an absolute last resort to deal with some terrible event. But in most cases, communities are much better at organizing and policing themselves. So look, this is something that is far, as Nathalie said, far past its time. And I do think, as someone who lived through the 60s, who was beat up by a cop, for the first time in my life, I see hope. Maybe Nathalie, maybe, you saw it 10 years ago and it didn't happen. I have to believe that now is a moment where we are so far in a better not a better place, so far able to have change that there is a hope and a possibility that we get it today.
Let's go to some of the comments that we have here. What trade-offs do you see in the state taking a greater role in planning and forming cities versus letting cities grow organically and not intervening even at the risk of widening inequalities? Let's give that question to Anita.
So there's so much packed into that
Yeah.
question, and I'm super excited to hear what the others have to say about this. But here's how I'm thinking about this. This is a time where we need innovation in social services, in the way that we run governance in cities, in the kinds of programs, social programs that we pursue. We need to think about new funding models. And by the way, a lot of this has actually been happening in some cities and in some communities and some national contexts over the course of the pandemic, where you have large infusions of capital and the redistribution of responsibilities, contractual responsibilities, such as for paying rent in Toronto and so on. Shauna knows a lot about that, but we need innovation of that kind to give people a fair shot at taking care of themselves, taking care of we have to confront the trade-offs and problems that began way before the pandemic and were amplified by it, and use this moment as a way to confront them and put energy at innovation. And I want to just give an example, and one that I'm thinking of actually is quite personal also. My brother is a retired investment banker who lives in Atlanta, Georgia. And what he did after he retired was start a program called Georgia Works, which supports homeless men. The Georgia Works is located right next to the Atlanta City Jail, and he supports homeless men as well as recent men who have been released from the jail for a year with housing. He gets them a job in exchange for working. And the program is designed to support these men in resolving their legal issues, dealing with debt problems. Many have children that they haven't interacted with, partners from whom they've been estranged. There's counseling every day. It's an alcohol-free, drug intolerant program. And what's happening is 92% of the men who are graduating from this program are not becoming homeless again, are not losing their homes. They've been supported to the point where they have skills, they have relationships, they have opportunities, education, and so on, that they can that they move past this tipping point of being vulnerable in that community. And that kind of human, person-to-person connection that Shauna alluded to, that Nathalie has been such a champion of, that compassionate engagement with people in trying to address problems that had accumulated way before COVID, and taking this as an opportunity to try to scale up interventions that are new, that can help overcome those problems, is a way to get past this and build back better, as we've been discussing.
COVID is actually really bringing to light a lot of very sensitive issues for people. You talked about addiction in Vancouver. We know that they're seeing a parallel pandemic with overdose deaths there during COVID. There's talk about decriminalizing drugs in order to try to save people who are dying of injecting illegal substances. And the idea behind that is to be able to offer a safe supply. Lots of people don't like this idea. Lots of people can't get used to this idea. As city planners and as people who think about living in urban areas and how to do that, what is it that you can say to the people who think this is far-fetched and not the direction that we need to be going in? I'll start with Nathalie.
Well, I think we've had the experience of the safe site of injections now for quite a while. I come from the city of Ottawa, and I represented a riding where we had 3 of the sites. And initially people were really scared and projecting all sorts of prejudice about what's going to happen. So it's the way it's managed, and it's the way in which it's not just providing the drugs, but providing access to the services that Anita describes. It's the way of reaching out people that can then come back and say, yeah, well, I actually need a place to stay tonight, and I need to resolve this aspect of my life, and so on. So it's either there to for people to so that we can reach this population, or it's underground. So it doesn't disappear. It's just, and that's the way in which you can think about this public policy. It's not, you know, one way or the other. It's there. It's just, are you trying to help it by recognizing it, or are you just pretending that it doesn't exist? You cannot criminalize. You cannot arrest your way out of drug addiction. You know, it hasn't worked. It hasn't worked in the States. It hasn't worked in Canada. You can try to arrest everybody that's an addict. It's not helping anybody. So I think that, you know, you have to think about the, you know, the way in which you connect with the trafficking and so on. There's lots of issues about the interactions between the different countries on this, but it's worth, I think, this opportunity that we have when we are looking at the way in which our cities, our country as organized. COVID has given us the opportunity to say, okay, there are lots of things that we can change. We have changed in 3 months. We've done lots of good things. Why can't we just not continue and not go back to the lethargic, paralyzed? We can't do that because we haven't thought about it. There's too many people opposed to it.
We surely have not talked enough about the mental health implications of this crisis in cities. I'm not an anxious person. I've never suffered for anxiety, but I can tell you back in March, I was really anxious and actually called my doctor up and said, can you give me a prescription of anti-anxiety? And he said, no, don't do that. Give it a few days. And fortunately it worked out, but I know the anxiety I personally felt. And there's been very little conversation about this. You mentioned the increase. We know that there has been an increase in both legal and illegal drug use. We know that there's been increases in alcohol abuse. We can even look at the upward spike. People say a gray of light sometimes as booze sales are up. We haven't talked much about domestic abuse, which tend to rise pretty dramatically in periods of economic crisis. So I think the conversation we really need to be having, as we've talked about public health in a kind of a narrow way, not to say not an important way, is the effects of this crisis on mental health. And then moreover, cities, you know, one of the things we know is that when people are isolated and alone, the mental health problems, all sorts of them tend to go up. Well, what do cities do? They bring us, for a variety of reasons, a lot of single people and people who are alone. So I think a deeper conversation about drug abuse, alcohol abuse, domestic abuse, and mental health is something that as time has really come.
Nathalie,
I just wanted to add that, you know, going back to what Nathalie had said, but also connected to Richard's points around, you know, challenges related to mental health, domestic abuse, that, you know, we know what the compassionate solutions are. I think at the sort of onset of the pandemic, there was a lot of talk about being kind and being generous. And there are people who are not interested in those kinds of approaches, that they don't appeal to them for ideological or political or experience-based reasons. But for some of those people, if what you say is, if we look at the economic rationale for supporting homelessness, for decriminalizing drugs, for defunding or shifting around how we fund the police and moving some of that funding to something else, there's a financial argument that says we can actually save money here, and we can also create a more compassionate society.
We have a question for Nathalie, which is, what are the main tools open to cities, such as Toronto, as opposed to the provincial or federal governments, to address racial and income inequality?
Well, I think the cities can certainly use all the powers that they have. And sometimes there is power within the city's charter. You know, it's not as though they cannot do anything. The real problem with cities is their lack of funding. It's not for lack of will. It's often is the lack of funding. So I think certainly housing is one. Doing it in a way that is supportive of equality goals as opposed to not supportive of equality goals, I think it will go a long way. I think there's lots of things that they can do on policing, lots of good things that is possible to do. I think the federal government must come to the table with some good funding here, and I think they will. It's just a question of how this can be sustainable, not just a crisis funding, but sustainable, so that the fundamental structural inequalities get addressed in a meaningful way, as opposed to just let's patch a little bit so it looks good. So I think that's the way to go. I think my work is more about is to ensure that there is sustainability, that if cities develop certain powers and have access to certain funding, they're not at the mercy of a new government yanking it out and then going backwards.
I wanted just to also mention that Nathalie and Shauna and I have been also thinking a lot about the arts and the importance of having shared experience through the arts during the pandemic, of having kind of that mutual experience of common expression, of common experience, and having that unify us in a way that's comforting and supportive and allows us to grow. So for me, I'll share with you that I have told my colleagues at the Rotman School of Management, that I'm not interested in teaching my young students anymore, my students in general, how to sell more Doritos, or how to advance consumption of stuff that's not important. I'm incredibly inspired by our students. I feel that and the junior fellows at Massey College, for example, they're incredibly committed to the values that are expressed in the Sustainable Development Goals. They want to fight climate change. They're interested in reducing inequality. They are against a frivolous consumption. They want equity in policing, and these values seem to be shared internationally. The international community response to Black Lives Matter has been incredibly powerful and compelling. And I think for me, what that means is we have to find a way of balancing across these different goals that society has expressed through the United Nations, through these Sustainable Development Goals, a kind of innovation to break the trade-offs that arise sometimes between these goals. You have to have funding for the arts. And we also have to have funding for education and for compassionate healthcare. We have to figure out how to do this innovatively. We have to figure out where we can do it at scale and where we have to do it locally, take initiatives locally here. One of the things we've learned during the pandemic is that no one can argue we can't do anything about climate. We had 70% reduction in air pollution for a couple of weeks. These are the kinds of opportunities where we need to align governance at the level of federal, provincial, city with the scale of the intervention that is the greatest opportunity for impact in achieving those goals and overcoming the trade-offs between them.
I want to build on what Anita said. And you mentioned it at the outset, Marcia. That's why we created a School of Cities at the University of Toronto. We looked around, and Shauna was part of it, and a group of people, and said, if you look at cities, they're the most important problem of modern society. In many ways, the corporation and the firm were the biggest problem of the old industrial society. But cities are where we come together. They're where pandemic disease takes off. That's where climate change can be dealt. We can go on and on. Where poverty nests, where innovation comes from. But yet the study of cities and the application of cities is fractured. We have Anita and I and several other people in the Rotman School. Shauna ran a program for urban affairs. We have an architecture department, a city planning department, but it's not congealed the way a law school or an engineering school or a business school has. And the hypothesis behind that was we could be the first, believe this or not, the first place in the world, not the first place in Canada or Toronto, the first place in the world that tried and Shauna discovered, she's going to correct me because I'm going to get this wrong, that upwards of 450 faculty members at the University of Toronto, which is the faculty of a small liberal arts college, were doing urbanism in some way, shape, or form in engineering and artificial intelligence and public health. And so I think what we're saying is, and we're all doing this in our own ways, these are not just problems in the world. These are problems of the way we think about and research and approach cities. And the good thing is, we have begun to create a capacity in Toronto at the University of Toronto for addressing some of these things.
Oh,
Richard, you're right. Several hundred researchers doing urban
you,
work
Shauna.
just at the
I got it from
university
you.
alone. And if you look at their networks that expand to universities internationally and to cities and governments and other organizations, and if you count all of the amazing students and student-led, student-run programs we have, you're in the multiple thousands.
If you want, I was going to come back a little bit about this issue of, do you have state intervention, or do you have let it 1,000 follow blooms and let's bottom up take place? As though I think that's a false opposition, because you will need, absolutely need some public investment. Whatever we've done at COVID, you know, we know that the program that supported employees worked. I mean, so there are ways in which what some of the innovations that were done through COVID could lead us, for example, to basic income strategies in different ways. So there are things that we've learned that because we had to do it quickly, that could be a leverage for the future and could be transformative. So I think we know that the old way in which politicians says, oh, we can never raise taxes, we know that's impossible. We are at a stage where we are as vulnerable as the most vulnerable human beings around us, because the disease can just travel so quickly. So someone said, you know, we're as vulnerable as the weakest public health system, and we are. So this creates a slightly different way of thinking about no longer an opposition between public and private, but we're both in the same, in a way that we need both, and we need both to be done well.
I also just wanted to pick up on this idea. I very much agree, and I want to pick up on this idea that Richard just mentioned briefly, that a lot of our systems, our core systems in our societies that are enacted in cities, are built on industrial thinking and industrial era ways of doing things. Achieve scale economies, you know, by offering everyone the same version of the same thing up to a point. Beyond that point, nobody gets anything, you know? And really what we're seeing here is a very deep transition in our society to a new framework, a new way of thinking about how we want to interact, how we want to live together in cities, how we want to structure our economic lives so that we're happier, we're healthier, we have better mental health, we aren't so isolated. You know, a great example of this that's emerged out of the pandemic has been elder care. Elder care in Canada, please allow me to say, has been a shameful, absolutely shameful revelation. You know, we need the wisdom and the, you know, the integrity, the connection that we have to our elders to be better integrated into our lives, make us less isolated. We need really deep and fundamental innovation in the way that this entire cadre of people in society are treated. And that, you know, really rethinking from fundamentals, you know, how we interact, it engages the humanities as well as the social and physical and medical sciences in a way that is very important.
I want to build on what Anita just said and what Nathalie said on the need to move away from industrial models and reinvent urban governance. Probably the single biggest failure of our current system and the current conversation is our unwillingness to take this issue of devolving power to cities seriously. And in this one, I think Canada is in a particularly difficult situation. Yes. I mean, we benefit from the fact that our federal government is relatively weaker compared to our provinces. And our provinces have done fairly well. Across the ideological spectrum, they've done pretty well. But our cities are horrifically weak, even by US standards. And Shauna and I have been part of something called the Canadian, it had various names. The last I checked in, it was called the Canadian Urban Project. An attempt to organize cities and mayors to demand of our federal and provincial governments more power. And not just more power, but more, you know, all of us ship money to the province and to the federal government, and they keep it, and then they give some limited amount of it back to us. The idea is not only to give power back, but to give resources back. And I think in this sense, because cities differ. You know, the problems of Toronto and Vancouver are very much different than the problems of Hamilton and London, which are really different than the problems of Guelph and Kelowna. I could go down, keep going on this. So cities have different challenges, and cities tend to know best how to solve them. So I think this idea, and the worrisome thing here, is if you look at the history of past pandemics, they tend not to dissipate into centralized power. They tend to be a time when, and I'll use this word, strong men, because that's been the case in the past, authoritarian figures rise up and say, I can save you from a deadly disease. So history suggests that in the wake of pandemics, we tend to get a more centralization. And I only wish, it's a wish and a hope and a prayer, that we can have a more robust conversation, and not just a conversation, begin an actual strategy to bring power down at the margin to cities and local communities.
Well, that's certainly, I think, one of the issue that's key to the work that we're continuing. We just got some funding to do a national conference on this, so which is how do you, and because in Canada, the other problem is not only do provinces are unequal, and the traditional way in which we imagine power is the province versus the feds, and they fight, and the cities are these kind of junior type government that maybe have to kind of beg for resources. And the big challenges is obviously that the politics in Canada is non-urban regions are overly represented in a way, you know, and have much more power because of our system of our electoral system. So, you know, we can have another good conversation about that, but within that framework, you need to be far more creative to create protections and levers to ensure that not only the power stays, but the money stays. Within a context where you will have to recognize that we will not tolerate in Canada such an unequal things that, you know, people in the north will have no electricity while people in Toronto are swimming in money. So the equalization thinking that we have between provinces, we will have to adjust it to recognizing, if we are serious about recognizing some additional powers of a city. So it's going to be additional powers, additional security, but also additional responsibilities.
Right. And I would just add that also at the city level, what we're seeing is a real kind of demand for a community-driven demand for greater participation, not just sort of consultation, but actually real engagement and power over decision making. And this, I think, is where the sort of planning profession comes in and has an opportunity to help reshape or continue to shape our cities and to shape them in the direction that we'd like to see them go. But in planning, we rely on evidence and we rely on engagement. And we're seeing both of those pieces increasingly become really prominent, especially in responses to COVID and in the kinds of initiatives that cities and municipal governments are undertaking. And the other thing I wanted to add is around the sort of governance innovation piece. You know, we've seen some really positive, rapid changes that cities, in particular municipal governments, have undertaken, whether it's passing bylaws to prohibit evictions, you know, sweeping out homeless camps in cities like San Jose and all of California, whether it's repurposing roads for a short-term kind of basis, implementing more rapidly bike lanes. But one of the questions that was raised when we were finalizing our governance innovation report was, you know, we know how to get to the kind of easy things, but how do we make those more radical, difficult changes? What do we need to do to get there? And what do those changes look like? And we're starting to see some of that really bubble up now, I think, you know, particularly around questions about, you know, what kind of funding do we give to police departments, and how do we shift that around? What kind of powers should municipalities have? What kinds of interactions and rebalancing of powers and authority do we maybe need at a Canadian level between the federal government, the province, and the city? So I think these are all really key questions, and we need these questions to drive us forward.
And one of the things that we've got a comment here about gentrification. So let's move to that aspect of cities. That is something that has not stopped or changed with COVID. It continues on barreling through some neighborhoods, displacing some people. There's segregation in neighborhoods that is happening right now in one Toronto neighborhood, at least a couple Toronto neighborhoods. There are tents that have popped up in what were public areas that are now tent cities, and they exist just a stone's throw away from, multi-million-dollar homes. And that does not seem to be stopping in this COVID-19 pandemic. And there are disproportionate rates of working poverty, people who are working poor in urban areas. How do we address this aspect of being a city?
We address it. We get to work on it. We don't push it under the rug. And look, it's interesting to have this conversation here, because the conversation in the States is cities will be abandoned, rightly or wrongly. And I think wrongly. The dominant conversation there is everyone of means in all industries is going to leave cities and move to smaller places and rural areas or suburbs. That is clearly not the case here. Our cities are strong, they're vibrant, and they will continue to attract investment, probably too much so. That's why I call this not the old urban crisis of urban decay, but a new urban crisis of poverty and homelessness and racial and class-based segmentation that comes from the very rebirth and revitalization and success of cities. So we have to address it. We will address it. And the reason is because as cities have come back, they've become arenas of contest, diversity and contestation. We no longer have all the wealthy people and all the industries out in the suburbs and loads of poor people in cities. We have a mixture. And so political pressure is rising on cities to say, how can we develop in ways that is more resilient, safer, healthier, more inclusive and equitable and just? And that's a political process that we have to work out. And I'll tell you, Toronto has to be a test case. Toronto and Vancouver have to be test cases for this. My big wake-up call came from looking at my colleague David Holchansky, well, Rob Ford, but that's another matter. David Holchansky's maps of the three cities of Toronto, a city that I moved to in the late 2007, 2008, and I thought was a much more cohesive and less unequal city than US cities. The wake-up call I got was David's maps, which showed incredible socioeconomic and racial segregation and a decay of the middle, a divergence between those areas of affluence and concentrated advantage and much larger areas of concentrated disadvantage. This is something we have to get, and it requires, you mentioned housing. It requires, because we have some of the most, look, Vancouver and Toronto are two of the most expensive and unaffordable and housing cost burdened cities in the world. It requires more affordable housing, public housing, social housing, whatever we need to do there. But it also requires, 50% of Torontonians, of Canadians, work in frontline service jobs and make terrible wages, never mind those chronically disadvantaged. As a society, we have got to commit to making those service jobs better, middle-class, family-supporting jobs. So, and we have to get to work on it now. And fortunately, I think the silver lining, the sliver of a silver lining, is the fact that the protest movement, the Black Lives Matters movement, the frontline service workers movement is telling us you have to come to grips with this to be a reasonable and just and civil society.
I wanted Richard to ask you a question about this, because to me, some of the insights that you offered about how the city will continue to be vibrant and important and so on are a little counterintuitive. So I can't help but notice that you have behind you the Toronto skyline on the photo behind you, and that it looks like that photo might have been taken a while back before we had the explosion of skyscrapers down at the Toronto waterfront. Is it? I hope I'm getting that right.
I don't know. Or my big head is blocking them.
I actually also am very interested in Marcia's answer to this question, since you are having this conversation every day on the radio and have so much insight about this. But, we have learned through the pandemic that a lot of this expensive real estate down in the downtown core may not be necessary, right? Working from home is truly a viable approach for many large companies, and there have been some famous examples, Twitter among them, of companies that have said, look, we don't need to go back. James Gorman, CEO of Morgan Stanley, with whom I worked at McKinsey, saying, maybe we don't need these large, expensive skyscrapers. Is there an opportunity here to repurpose or redevelop the urban core in a way that would make the city more powerful, more vibrant, more interesting, more engaging, and more humane?
Absolutely. Thank you for asking me that. One of the things that I've always noticed, I love downtown. I love living downtown. And my first apartment was right on the subway line, and I felt so lucky to be there. But I also noticed that Monday to Friday, it was the multicultural city that we all, pat ourselves on the back as living in. But on the weekends, it was not. It was very white and very wealthy, or they were people who were coming in from out of town to go to expensive events downtown. And I just found it so remarkable. And you can see, like, you're at the Bloor subway station, you're watching where people go, and all of the people of color go downstairs to the lines that take you across town, and all of the wealthy people do the university loop. And I was talking to a friend whose job it is to maintain one of the big buildings downtown. And I said to him, in this era, his building is empty. It usually has maybe a couple of thousand people in it. There are 60 people in it. Can that building be repurposed to have housing? Can you change it? And I got a real education. He said, it costs tens of millions of dollars to change the air systems and all the life support things that you would need to turn that into, say, a residential space, which would be great, and an opportunity to have more people come to the city who are now living on the outskirts, but who may have at one time either worked in the city or could make a life in the city. And it looks as if, from his perspective, which is just one perspective, the will isn't there. And there is the belief that these office towers will once again return to their use. So I put that to you. Richard, you're shaking your head saying no.
No, I agree with you. I think if you look at the things that create vibrancy in cities, and you even talk to people in Lower Manhattan after 9/11 about what brought that neighborhood back, and in fact, it's a question I asked Jane Jacobs at the time, turning corporate office towers into residential was a key factor. So look, in a city that has such horrific segmentation and housing affordability, with cities, Toronto and Vancouver, it's like a no-brainer. We have to do it. And it may take political will and it may take resources, but repurposing those office towers. Look, the best surveys I have seen suggest that about 40% of the workforce, professional knowledge workers, can work online. No more than half of them will continue to work remotely. So, but who will go back to the office? The people who are going to go back to the office are less advantaged, less affluent, early in their career, and young. Young people who are stacked 5 and 6 people to an apartment are going to need an office, but many others won't. What are the prime uses that take up space at a downtown? One is office. We can repurpose that. Retail. Shopping online. One of the biggest changes I've observed in Toronto is before the pandemic, it was hard to get stuff delivered. Now you can have stuff delivered near instantaneously in this city. The change in our online retail grocery delivery infrastructure has happened overnight. And universities and schools. We like having space at the University of Toronto. I love my office. But in fact, a lot of that can also be done remotely. We have an opportunity to repurpose commercial office, retail space, and educational space. Not all of it, but a good deal of it, to house people in one of the most expensive cities to afford residential real estate in the world. That should be front and center in our conversation about building a more inclusive and just city.
You mentioned schools. Can we put schools into those buildings too?
Well,
because that is often the thing that is missing in neighborhoods.
But I think that the opportunities are there. I remember when we were looking at housing, about the ability that you could do with having you know, the school or the daycare. You can have a daycare there, and then they had the dog park planned to be on the top on a green roof or something. You know, so there's lots of imagination that can be done with architecture to reflect a change. And I agree with Richard. If we don't do it, workers, the workers that are needed to keep the city alive, will have to travel so far out to be, so it's not only inefficient, but it will create a terrible deadlock. The workers need to be close to the place where they work. Otherwise, you lose this workforce. So I think that's the other economic argument to convince developers that it's not enough to simply build for one purpose. It has to have the ability to be a sustainable, wholesome environment.
What about, how does that connect to gentrification, which was where Marcia started us? You know, does that, are we seeing like a reshuffling or a re-gentrification on different terms, or is this have the capacity to stop gentrification, do you think?
Well, hopefully
You know, I
this
might
would
be
stop.
total.
Go ahead, Shauna.
I might be totally in denial. I might be really in denial here, but I think it's far too soon to know whether or not this devastates, in particular, our downtown office and retail sectors. I think we have sort of gone over and above, sort of with extraordinary efforts to make the transition to work from home in so many sectors. And I know in the university environment that is absolutely the case. But you know, at some point you need to work with people, you need to see people face to face, you need to have meetings. Innovation happens when ideas and people who have those ideas and who can work together, can both bump into one another sort of coincidentally, but also who can really build on those things by building relationships and by building teams. And, you know, most of us are able to work during this period because we already have, you know, people who are more advanced in their careers, they have their teams already. We already know who we're working with, and we have enough of a pipeline perhaps to make the transition now. But to think about the sort of long-term implications, and will that, you know, create this tremendous proportion of new space in the city. I mean, I was just looking at the numbers of jobs and the location of jobs in Toronto, and something like 37% or more than a third of all employment in the city is in the downtown core. And there's a lot of sort of commuting to and from that core, but also many people who live there. But I just think that after 3 months, it's still too soon to really know. And if we look at the past, the car was expected to kill the city and it didn't. The internet was expected to be the end of the city and it wasn't yet. And coronavirus is also not the end of the city. But I think we, you know, thinking about, well, we're at this moment of change. Do we have the aptitude and the vision to identify where we can make these positive changes? So, you know, if we know that in the past we've seen, you know, recessions in cities where there has been a movement out, but then when we look, you know, 20 years on, we see actually the real estate in those cities is even more expensive. They're even more unequal. They're more divided. So how do we make sure that we don't get to a worse sort of outcome now? Is it repurposing office buildings for housing despite the big expenses, or is it something else?
So to build on that and go back to Anita's point, just where you stopped, Shauna, if we do nothing, I can almost guarantee you that our cities will become more gentrified, more unequal, and more segregated. That the forces that have led to the, you know, if I had to say one real mistake I made, it's that every time there was a crisis and I said cities would come back and most people said, no, they wouldn't, they'll be moved to suburbs. I didn't say it loud enough, cities would come back, and I completely blew it. I completely underestimated, in the face of that criticism, how fast cities would come back after 9/11 and after the economic crash. I didn't believe it. And I never believed that gentrification could occur. Now, others did, probably smarter and more, that gentrification could occur at this level of veracity that we've seen over the past decade, where cities have been colonized, parts of cities, not all cities, parts of cities have been colonized not only by the affluent, but we have these luxury towers that are empty because people are investing in real estate as if it was another grade A investment asset. Look at parts of Vancouver, London, Toronto, New York. So if we do nothing, and look, it's not just going to be in who occupies the space. With an environment of social distancing, and there will be fewer seats in restaurants. All the things that make cities interesting, fewer seats in theaters, fewer seats in a concert. That means the prices will go up. That means wealthy people will be able to consume them or have the concert delivered to their lovely apartment or their block party or have the restaurant come to them. Our society will become unequal in ways we can hardly imagine. And that's why the Black Lives Matter protests, and I would say equally, sometimes the frontline service workers, job actions and strikes are so critical because they are the seeds of a movement. They are a movement that says that we have to do things differently. And if we don't, what we have seen will continue and it will worsen. So this one is on us collectively. We have to now do the hard work, and it is really hard work, not only combating gentrification, but making our cities the kind of places that everyone has a good job. These should be basic human rights, right? Access to a good job that pays, access to good housing for yourself and your family, access to housing, access to relatively equal education. They should be basic human rights that people are guaranteed in cities.
You have all been accused of being idealists and incredibly positive about cities. The question from one of the people watching is, why is this kind of idealism not happening about cities in the United States?
The United States
Can
has
we
a
leave
lot
this
of
to the
problems.
Americans?
The United States has a lot of problems. I mean, we have, I mean, I don't have enough time to describe them all. So let me just pick off some of the most salient that are related to the conversation that we've been having. The United States was built on the enslavement of Black people. It was a key feature, a critical feature of the Southern economy from, the arrival of Europeans all the way through the Civil War. Then it gave way to a failed Reconstruction and a convict leasing system. It gave way to a new kind of structural slavery that we are still addressing in the United States. And the lack of progress on that agenda, especially over the recent past, it's been, don't get me wrong, there's been a lack of progress on this for a long time, but there's no appetite among the great majority of Americans to continue this. We have to stop it, we have to fight it, and that is that means prison reform, it means police reform, it means reform of housing, it means reform of job security, of education systems. It means a lot of conversation and awareness building through cultural activities, what we watch on Netflix, the way we consume knowledge in the United States is not even only through the education system. So there's a whole powerful movement underway to try to address this. We also have enormous challenges in the United States in dealing with, and a lot of this has to do with cities, in dealing with other massive issues like especially climate change, structural problems in our economy that have to do with that, with international trade, with globalization, with national leadership. All of this stuff is disrupting the way that we interact and live together and so on. So, I hope that something major can occur here in the coming months that will take this on. If we're not successful in implementing change in the United States, then I want to join our commentator in some pessimism, because we have to seize the moment to do something great here, where the alternative to greatness is not the old normal. The alternative to doing something major is massive tragedy.
I mean, I have to be an idealist because I couldn't live with myself if I wasn't. Like, I just have to try to make the world better You know, in retrospect, Anita and I came to Canada at about the same time, and I didn't know it would be then such a good decision, especially with 2 little kids, but it ends up being the smartest decision I ever made. That said, even given the tremendous problems facing the United States is in a very unique position with arguably its worst president and certainly its most dysfunctional president and administration in history. You know, if you play this out to November and January, not saying any of those problems will be solved, and Anita was spot on. You know, Jane Jacobs said to me in our last conversation, the plantation economy is the seeds of all of this. So spot on with the analysis. But, you know, if Biden and a vice president who's more representative happens to be an African-American woman, and there's an administration that more is reflected of the diversity of American society, it won't fix all of that. But it could point the way out of this gloom and doom. So I wouldn't, you know, my dad was a very smart man with a 7th grade education. He said, just never count America out. It can change quickly. And that's not, this is probably one of the darkest periods since what, the Civil War that America's gone through. But I think from our Northern vantage point, I would just say, let's hope, as Anita said, that over the next few months, we get past this horrific place that the United States is in, that this bubbling up that we're seeing in our cities and communities continues. There's a new person a new president and vice president in the White House, and we can begin the process of not only healing but change. Let's keep our fingers crossed that can happen.
You know, I can't help but to say, Richard, that my mother said the same thing to me just the other day that your father said to you, which is never underestimate the capabilities of the American people to get change done. We just need a way forward to make it happen, I think.
Well, let's get back to our city here. And something that is massively changing here is the transit system. It has been under construction forever, and it won't be under construction until potentially 2022, when we'll see a brand new line across the midsection of the city, Eglinton Crosstown. There is a bill that is being considered by the Ontario government right now, Bill 171. And Shauna, I'll give this question to you. If you don't know about it, or if people watching don't know about it, it's a transportation bill designed to push through the building of transit. The latest line in the Eglinton is the Eglinton Crosstown. It prioritizes the building of transportation over the communities and individuals who would be directly affected. Right now, a section of that line is going right through Little Jamaica. And it was one of the first places where Black Canadians came to gather and set up a business. There was also Bathurst Street, but let's talk about Eglinton for right now. And the businesses have been struggling for so very long, and there is no relief until 2022 at least. There are 2 questions in this. Small businesses, how are they supposed to hold on in such a hostile environment that is this construction that goes on? And then, Shauna, how necessary is a bill like this to get transit built in this province?
Those are great questions, Marcia. And I live near Eglinton. And so I am very familiar with both the construction, the length and duration of the construction, how disruptive it has been to small businesses, to the community, how much it has contributed to added congestion in and around, and the sort of the Eglinton West transit line has been already delayed a couple of times. It was supposed to be ready, I think it was this year sometime. And has been delayed another year and then another year after that. There are a few pieces about this that I think are really important before I go into this particular act. One piece is that one of the really sort of positive things about the building of the line was the use of a community benefits agreement. I haven't followed up recently to learn more about the kinds of jobs and training that have been provided to communities particularly affected by the construction, but also as a way of providing jobs and training to young people, and especially in neighborhoods where there are very sort of racialized and marginalized and low-income populations. And so that community benefits agreement was part of what the the Ontario Liberal government had put into place when they began to initiate construction and development of that line. And the second piece is that by their very nature, you know, major transportation infrastructure projects are disruptive, and they do have an impact on the communities around them, at least in the short term. But what we think of as short term for infrastructure might be several years rather than a couple of months. And then that infrastructure, after it's built, is around and used for 50 years or 75 years. And so the message that short-term pain for long-term gain is a very bitter pill to swallow, especially right now. And I have watched as businesses along Eglinton, and particularly west of Marley, have really struggled. As gentrification, I think, is starting to come in, because developers are seeing that that land will become more valuable because it will become more easily accessible. And so the community benefits agreement alone is not, and, you know, creating jobs and training will not be enough. There needs to be more done. This particular act, the Building Transit Faster Act, sort of acknowledges some of the slowdowns and the barriers to building faster. So it removes obstructions to construction. It eliminates some hearings for expropriation and the need for hearings, and that's very sort of alarming and concerning. It can require the moving of utility infrastructure, and another element of it is that it may circumvent municipal right-of-way access if negotiations are unsuccessful. It provides a lot of authority to Metrolinx, the regional transportation agency, to govern and manage the construction project. And so on the one hand, we need these rapid transit corridors to move people around our city and around our city region. We're growing very rapidly. The metropolitan Toronto area grew at over 100,000 people last year. It's estimated to be something like close to 10 million people in the broader region in the next 25 years, but even right now, over 6 million people, with the largest number concentrated in the city. And so we need to think about, you know, how do we get these transit projects initiated, but what kinds of supports can we provide to small businesses? One of the supports that's been provided is that there is free on-street parking to make up for the construction impediments. And so it's both on-street and when the construction is not right in that spot, and also in some of the city-owned parking lots. Now, that's part of, you know, the idea that is to bring in people who are driving to be able to access these amenities. But what about direct supports for retailers? And the same exact conversations were had when the St. Clair West streetcar and the St. Clair streetcar was being built probably close to 15 years ago. Businesses struggled there very much. This doesn't help for the businesses that are there now, but that are there today who are struggling. But if you go back to St. Clair West now, you actually see a lot of new small businesses emerging, and a lot of sort of very local activity. But it wasn't easy, and it took a long time, and it was painful. And so, particularly at a time when there is a delay, and at a time where we know these are already low-income neighborhoods, we need to think about, again, what kinds of opportunities, what kinds of supports can we provide? So instead of just making things faster, how do we better support the communities that are so directly affected? How do we think about sort of democratic principles that underlie the engagement and the interaction and the connection of the residents of that area, so that everybody benefits, not just those who will ultimately travel through the neighborhood or travel to it, but so that people there now can really survive.
Do you think that if there was a recognition that it contains some of the city's heritage, some of the stuff that makes Toronto what it is, that people might value that a little bit more and move to work faster to offer protections and think creatively about saving that as a heritage area?
That's a very tricky question, because sometimes what happens and what neighborhood advocates are accused of is creating this heritage protection as a way of preventing new activity or new development, and particularly increasing the density of the neighborhood. So in some parts of Eglinton West, there is very low-rise development, and if heritage designation means that you can't build up, then what you're doing is you're encouraging spread, you're encouraging urban spread, and you're encouraging sort of the risk of not being able to change in a way that the community might benefit from. I think Anita had something to add there.
I think Nathalie.
Yes. Well, I just wanted to, this is a shell act in this way. It does increase the power of the minister and the power of Metrolinx. The minister did say that she is hoping to develop a consultation and a method of connecting with the cities. So we don't know yet how it's going to be implemented. And that's going to be key, because that goes back a little bit to some of the thematics that we've been talking about. If you're going to go back to a way of saying, well, the private sector wants this and wants this quickly, so therefore we're going to just kind of railroad this development and not support the local businesses and avoid thinking about an increased package for community development, I think we're just going back to the same old thinking. This is an opportunity to say to the minister, okay, well, let's think creatively here, because we've just been in COVID helping businesses survive. Why don't we just take that package and put it in the context of supporting people that are going to be badly affected for maybe the longer public good. So it's an opportunity, I think, to push our thinking a little bit, instead of having I was reading her speech today saying, oh, it's red tape, we want to avoid red tape. Well, it's enough, it's to talk about this and recognize what's the importance of not losing the heritage character, not losing a community, because that's what makes Toronto vibrant. Otherwise, there's no point, there's no point in coming to it.
Richard, I know you have to leave us soon, and we are at time. This has been a very good discussion. I want to give you a couple of the final words anyway. You have said that this COVID pandemic is an amazing opportunity for change. What do you want to leave us with on that fact?
I mean, I would have, who would have imagined in March of this year that this kind of change could happen? And I think our first thoughts was, oh my God, as Shauna said, the end of cities is near. We'll have abandoned office buildings. Everyone will work remotely. Our small businesses will disappear. We'll have cities deadened of arts and culture, and all those things are very real threats. They are. But in very quick succession, we've seen the igniting of people's consciousness, their awareness, a Black Lives Matter movement, the most powerful cross-class, cross-racial global movement I've ever seen for social and class justice, a movement of frontline service workers, in our factories, in our delivery businesses, in our groceries and retail shops, saying we need to be paid more. And by the way, not only we need personal protective equipment so we can keep your economy up and running for you by keeping us safe. And the conversation we had today is unimaginable. It is literally, to me, 40 years into an academic, unimaginable before March of this year. And so it is just, I know, you don't want to seem Pollyannish or overly idealistic, but it is a time of deep questioning in our society where it appears that we have a political force, a pretty formidable political force that will put this on the agenda. So I'm cautiously realistic, but I am optimistic that at the end of this, if we're strategic and intentional and we invest and we listen to all the voices in this conversation, that we can come out of this. They won't be perfect cities. They won't be utopian cities. They'll still have many challenges, but they could be better than what we have today. So that gives me purpose and meaning.
Thank you for that. And thank you for the reminder of the word and the use of the word intentional, because I think that is what a lot of the people in the movement are trying to get people to understand, that if you want change, you have to be intentional when you think of your Black neighbors and colleagues and coworkers and friends and family. Anita, do you have some final words? We didn't get to talk about the environment and heading back to work and the kinds of things that we can expect. We had just so much that we wanted to get to, but some final thoughts from you.
I just want to thank you, Marcia, for leading us in this conversation and for leading all Canadians in our thinking in the way that you do. It's been an enormous pleasure to work with you today, and thank you for everything you're doing for the Innovation Policy Lab and at the Munk School and for Massey College and for the School of Cities and for our country.
All right, thank you. And Nathalie, I'd like to put that to you as well. Someone has said, beautifully said, Anita.
Yes, it's hard to beat that. Just to say thank you for the honor of participating in this discussion. Let's continue to be intentional and to ask these questions. I think there is a role for the academic community here, not to shy away from the big challenges and to be more creative and more present, to say there is, if we have to reinvent the future, we cannot let this crisis waste. We have to make it fair. We have to make it devoid of racism. That's, let's just do it. And I think that's I think the challenge that we have.
And Shauna?
I would just like to echo everybody's thanks and appreciation. This conversation and these series of webinars really came out of our virtual world as we thought about how do we transition to a during COVID era, and they've actually been a remarkable way for us to, put all of our heads together and really work collaboratively, which is what is needed to think through all of the impacts on the system of cities and how we can come out better. So just thank you, everyone, and thank you especially, Marcia.
Thank you very much. This has been an absolute pleasure. We are 5 minutes over time, and I'm so glad that you could all join us and help us to rethink how we're going to approach cities after COVID, and talk about some of the good things that have been happening, and with your idealistic, positive selves. Thank you very much. And I am looking forward to seeing how this conversation continues and unfolds, and how people act after hearing some of the things that you've all had to say today. Thank you.
Thank you.
And that wraps up our discussion for the Innovation Policy Lab at Munk School of Global Affairs and Public Policy, School of Cities, and at the University of Toronto and Massey College. Thank you all very much for joining us. Good evening.